Hello. Today we're going to talk a little bit about object relations theory. What is it? Um, it's a term that comes from a whole line of British theorists who followed Sigmund Freud, like Melanie Klein, Ronald Fairbairn, D.W. Winnicott, Michael Balin, Wilfred Bion. These are British theorists that then led to us American object relations theorists, one of which I am. We have here also Margaret Mahler, Althea Horner, Thomas Ogden, Michael Eigen, different object relations and theorists in the American tradition. But I'm going to break it down to some very basic fundamental things about development that make it meaningful to all of us. First of all, through infant research, we have been validating what the original object relations theorists were saying, which is that from the beginning of life, and Ronald Fairbairn said this explicitly, we yearn for connection with another. The infant with the mother, Winnicott says it as there's no baby without the mother, there's no mother without a baby. The mother is made into a mother by mothering a baby, and the baby couldn't exist without mother. So that's another way of saying we have to have connection. That's what makes us human. But that's what makes us human initially, and it's also what allows us to develop and become personalities and go through all the stages of development to become adults. So initially, we have that primal connection with the mother, and we talk about the breast mother, the initial connection with the breast through feeding, but then through being held in the holding environment that Winnicott talks about with the mother. And then connection, but there's also then separation, individuation that Margaret Mahler talks about, where we have to also be able to be separate from the mother and internalize her and sustain connection while being more independent, separate, and having our autonomy. And there's a whole dance back and forth between being separate, coming back to mother, and being with her, just being with her, with our needs without her intruding. These are all things that Winnicott talked about. That way we internalize some of mother so that we can be more on our own. In fact, Winnicott talks about the capacity to be alone. If we can be alone with a mother with us or another therapist with a patient with them, certain psychological experiences of another inside of us get built into us, and then we can be alone with ourselves and have our own internal dialogues and have a sense of presence with another rather than feeling a void or a vacuum or a total emptiness inside. So this is what helps make us human. This is what allows us to be creative. This is what allows us to have a free flow of thoughts and feelings through us rather than to be paralyzed, cut off, numbed out, and have symptoms of all kinds. As long as we have this internal connection and we can flow and we can dance Argentine tango, where it's all about the flow of partnership, of lead and follow, and the organic flow of connection. So in object relations theory, we're always talking about when there's contact and connection and when that gets disrupted, and whether there's been traumatic disruptions, especially early on in the first 3 years of life when the self is just forming. If there's been early trauma where there isn't a sustained good enough connection with the mother because the mother got ill or died, or the mother was too engulfing or not allowing separation, or distancing and not allowing connection, all of that could intrude on the sustaining connection with the mother enough for her to be internalized in a good enough way to build in a good sense of self. And if we don't have that built in the first 3 years of life, then all the other stages of development are impaired, and there are problems in connecting and sustaining connection with people tolerating our aggression, our sexuality, our anger, and sustaining a relationship through that. And without that early sustained connection that's internalized, people are always disrupting their relationships and running from one to the other because they feel the other is terribly bad or disappointing or inadequate the minute they get re-triggered in their feeling of disruption of connection, and then they run to another one to be the early ideal symbiotic mother before the separation phases took place. So object relations theory deals with these very early primal things, but how they're operating in the moment today, in the person today, in the therapy session, but in their life all the time, and how it then manifests in the therapy session. So we get a handle on how to treat it through it happening with us as psychotherapists. So unlike other schools of thought that talk about making the unconscious conscious in psychoanalytic theory, we talk about that too, and things repressed, but we also deal with trauma and early disruptions in development that recreate disruption in relationships and how to repair that through treatment in object relations terms. Because there are people who don't get to a level where they can have repression. Sigmund Freud talked about repression in neurotics who might be too rigid, uptight, and have all these neurotic symptoms because they repress parts of themselves, their sexual impulses, their aggressive impulses, and then they have to unrepress that in a psychoanalytic treatment. But there are a lot of people that don't even have the luxury of repression and the containing aspects of repression because they've been so disrupted early on in their primal connection with the mother and haven't internalized her as good enough and have that sense of self built in from a sustained internal sense of her being there. Without that, when it gets traumatically disrupted and their sense of self isn't built in yet, they don't even have the luxury of repression. Instead, they just have such aversive reactions that they split them off, dissociate them, push them and deflect them into others. In another tape I have, we talked about projective identification, putting them into somebody else because they can't tolerate containing what comes up in them in relation to the other person. Of course, these are people who also can't contain what comes up in them when they're alone and without a person either. So they're damned if they do and damned if they don't. They can't be in a relationship and they can't be out of a relationship. Now, perhaps because of anti-feminist trends, this has often been said about women, that the guy who says, I need a woman, I can't live without women, but you can't live with them. Well, it's actually about human beings. If you have a problem being with another person and sustaining, it's not about a man or a woman. It's about a primal need for another. And anyone who cannot tolerate what comes up inside of them when they're in a relationship and disrupts the relationship will be in this damned if you do and damned if you don't position, that you can't be with them and you can't be without them. You're either too abysmally alone and then become detached away from your own inner self and live in some kind of false self and try to use your intellect to get by, but really are emptying out what's inside, putting them to others and feeling threatened then by what comes back at you from those projections and deflections out into others. Or feeling such a sense of void that people run to drugs, alcohol, and all kinds of addictions to fill up the void. So it's the only way we can repair this is by an understanding of object relations thinking and how treatment can do what cannot take place in any other way, which is having another human being there in a consistent way containing their own inner experiences so that they can tolerate what's deflected into them and they can help you, the therapy patient, understand what they experienced early on that's being repeated now, re-triggered, and in their traumatized state. And gradually these things can be felt by the patient as the therapist or psychoanalyst helps contain the feeling affects of the states, and also puts into words what they mean and help them understand the link between what was disrupted in the past of contact and connection with that primary need for the mother and how that's operating today and causing all this sadomasochistic drama in their relationships today that go on right now. That makes them feel damned if they do and damned if they don't. Only with the trained psychoanalyst who can experience this and put it into words as it's happening in a personal way with them, with the patient, can over time the patient realize what's being triggered in them again and again and why they're having such troubles in their relationships or why they isolate themselves and are afraid of even being in a relationship. So although it is difficult to commit then to a therapy schedule where they come regularly and they're committed to appear at a certain time to pay the therapist, these are the conditions necessary to make it possible for the therapist to be there who's experienced and trained, commit their time, get a fee for their experience and their commitment of time. And therefore, this is a person who could be with them in a way nobody else in their life can. Because everywhere else in their life, they're going to be re-triggered and other people are going to just either walk away from them or get back at them in some way and retaliate because they get reactive to what they're trying to, their hostilities and that they're putting out to get away from relationship. So only the trained psychoanalyst, object relations psychoanalyst can process this and contain it and then help in a very related, warm way, help the patient understand it. And the therapist sometimes has their own reaction, but it's the training and the experience that allows us to use those reactions to understand what's being re-triggered in us of the child in the patient that's screaming for help and who's hungry and starving and therefore enraged, or also to feel that they're being made to feel like a sadistic persecutory parent who's being mean to them or attacking them, and can feel these things but not actually do these things and not actually react these ways, but to take their reactions and try to keep them internal and use them to understand what the patient is going through. That's a recreation, re-triggering of early disruptions in contact and connections in the earliest time of life. So this is an ongoing process and a communication process. Gradually, the patient can come to trust the therapist, even if sometimes the therapist gets, a little reactive, a little angry, a little distant. That can be talked about too, as long as it's not too much and it's not like they get in their other relationships where it really becomes a whole hostile sadomasochistic pattern of one person reacting and the other reacting back in a mean and hostile way or abandoning or depriving. And with the analyst who's trained and works with this continually, there's a communication that can go on with the adult part of the person so that they can understand what they're trying to provoke in the therapist because of what's inside of them that they can't tolerate. Because it has to do with the traumatic disruption of contact and connection in the earliest time of life. So that's what all the time for today about object relations theory.